Welcome back. In part 1, we established that your SI joint is a stabilizing foundation. That SI joint pain comes from the mechanical shift, sacral torsion, or stuck ilium, and that Gonstead pelvic adjustment corrects that shift at the root cause. In part 2, we are going to clear up the myth that keep people stuck. Trace the SI joint connection through your body. I will give you 2 things you can start doing today. Let's go. A lot of patients comes to my clinic with a very frustrating story. They say, "Doctor, I had pain for months. I've had an MRI, an X-ray, maybe even CT scan. Everything came back normal, so either I'm imagining this or need injection to numb the angry nerve." Let me be very clear. SI joint pain is frequently a mechanical problem, not a structural damage problem. And mechanical problems, joint misalignment, ligament strain, muscle imbalance, do not show up on MRI. An MRI is excellent for looking at disc, tumors, infections, and fractures, but it is static image. It is photograph. Your SI joint dysfunction happens in motion. It happens when you stand up from a chair, when you climb upstairs, when you shift your weight from one leg to the other. No photograph is going to capture that. This is one of the core reasons why SI joint pain is so often misdiagnosed. The pain pattern mimics a lumbar disc problem. It can radiate into buttock, down back of your leg, sometimes even into groin. Patients get labeled as disc patients and are funneled toward the epidural injection or disc surgery. But if the actual source is SI joint, none of these treatments address root cause. And here's another myth I want to address. The idea that rest will fix SI joint pain for an acute sprain, something that happens yesterday or the day before. A short period of relief rest, maybe 24 to 48 hours, is reasonable. But prolonged rest, 1 week, 2 weeks, that makes it worse. The muscles that stabilize SI joint, your glutes medius, your deep core stabilizers, your multifidus, they weaken when you don't use them, just like the other muscles. The joint become less stable, not more. This is why chronic SI joint pain is so common. People rest too long, the muscles shut down, the joint loses support, and the pain becomes a cycle. The biopsychosocial model teaches us that pain is not just mechanical signal. Chronic pain involves the nerve system, stress, sleep quality, emotional state. But that doesn't mean the mechanical component goes away. It means we need to address both, fix the structure and support the nervous system. That's what we do at Gonstead Care. Remember, the body is the integrated system. You cannot look at SI joint in isolation. Let me walk you through the kinetic chain because this is where Gonstead model really shines. Go upward from SI joint. When one side of your pelvis is shifted, your lumbar spine has to curve to keep your head level. This creates functional scoliosis, not a structural curve of the vertebrae themselves, but a compensatory curve. The muscle on the one side of your lower back get tight and overworked. The muscle on the other side gets stretched and weak. This is why SI joint pain is often comes with the one-sided lower back muscle spasm. And if that compensatory curve travels higher, you can start seeing tension in the thoracic spine, neck pain, and even headaches. Patient will come in complaining about their neck, and the answer is sitting down in their pelvis. Now go downward. The SI joint sits directly above your hip joint. If the pelvis is tilted, hip joint loads unevenly. Over time, this can contribute to hip osteoarthritis on one side. Further down, a pelvic shift creates a functional leg length discrepancy. One leg appears shorter than the other, even though bones are same length. Obviously, there's a cases anatomical leg length deficiency happen, and Gonstead pelvic analysis can measure by millimeter length. One leg appears shorter than the other, even though the bones are same length. This changes how your knee tracks, how your ankle pronates, and how your foot strikes on the ground. I have seen patients who came in for knee pain or shin splint, and the correction was at the SI joint. This is why in Gonstead, we never treat just painful spot. We assess the entire kinetic chain, from occiput down to the feet, and we correct the primary dysfunction. When primary problem is fixed, the compensations above and below often resolve on their own. So what do we do about it? We need to restore stability. I'm going to give you two things you can start doing today. These are not cures. If you have significant SI joint dysfunction, you need a proper assessment and adjustment. But these will help you start moving in the right direction. First, find your neutral pelvis. Lie on your back on a firm surface, your bed or mat on the floor. Bend your knees so your feet are flat, about hip width apart. Now slowly rock your pelvis. Tilt it forward so your lower back arches off the floor. Then tilt it backwards so your lower back flattens against the floor. Now find the middle, the position where your lower back has a neutral, gentle curve and your pelvis feels balanced. This is your neutral pelvis. Hold it there. Breathe slowly. Just being aware of the position is the first step toward retaining your body. Second, gluteal activation. From the same neutral pelvic position, squeeze your bottom muscle gently, about 40%, 50% effort, not to the maximum. Hold for 5 seconds, release, repeat 10 times. This activates gluteus maximus, one of the primary stabilizer of the SI joint. Maybe it sounds simple, and that's the point. SI joint stability is not about the doing aggressive exercise. It is about waking up the muscle that are supposed to be working all the time and aren't. One thing to avoid, stop sitting with the one leg crossed over the other for a long period. That position, the figure 4 sit, puts asymmetrical torque on the SI joint every single time. If you have SI joint pain, that habit is quietly making it worse. To summarize today's lesson, number one, SI joint pain is caused by the mechanical shift or subluxation of the pelvis and sacrum, not by degeneration or damage requires surgery. When we find and correct the structural problem with the Gonstead pelvic adjustment, the pain resolves. Two, a normal X-ray MRI does not mean nothing is wrong. The SI joint is motion-based problem, and static imaging cannot capture it usually. It has to be analyzed carefully by the Gonstead pelvic analysis. Functional tests like FADIR tell us far more than scan ever will. You can check the previous video if you want to check this test. 3. Stability is key. The SI joint needs strong ligaments and active stabilizing muscles. Rest alone will not fix it. Movement awareness and proper correction are the best tool for healing. Thanks for joining me for both part of the SI joint deep dive. I hope you now have a clear picture of what actually going on in your body and some practical steps you can start using today. Remember why I made this in two parts. If most people understood this, we would take enormous amount of the unnecessary pain out of this world and prevent so many unnecessary medication, injection, and surgeries. So if this helped you, please share it. Send it to one person who's been told their MRI is completely normal, but still they have a lot of pain. That one share might change their path. Now, if you've been dealing with this kind of pain and you want a real answer, I can help. And I personally review cases for education purpose. If you have an MRI, X-ray exam result, send them over and I will take a look at your case with you. If you're in or near Shanghai, China, you can come into the clinic and I can check you in person. Send me an email, I will take a look at your case and answer it. Assess the SI joint, find the primary subluxation, and correct it at the root cause. You can reach me at here now that we understand how the SI joint connects the spine to pelvis and how structure shift create pain that mimics disc problems. Our next logical step is looking at spinal stenosis, a condition often confused with both sciatica and SI joint pain, but with its own distinctive mechanical cause. Make sure to watch the next video in the curriculum, where we will build directly on what we learned today. Remember, your body is designed to heal when the interference is removed. See you in next video.